On behalf of the Sri Lanka Red Cross Society, I'm honored to welcome all the members of the media, distinguished guests, representatives from the Ministry of Health, National Dengue Control Unit, International Red Cross and Red Crescent Societies, and all the members who are just joined with us today. And also I would like to warmly welcome Dr. Anura Ekanaike and all the other government stakeholders who joined with us physically, although they are not with us physically, but they are just joined with us virtually today. We gather here for a significant milestone, which is the official launch of the world's very first simplified early action protocol on dengue prevention. So this pioneering initiative reflects our shared commitment of strengthening early action, protecting communities, and advancing Sri Lanka's leadership in innovative public health solutions. And it's time for our presentation on the simplified early action protocol on dengue prevention. And I'm pleased to invite Ms. Dilini Ramasinghe in the Focal Health Department of the Sri Lanka's Red Cross Society to deliver the presentation. And Madam, the floor is yours.
Director, National Dengue Control Unit, and the consultants, the Secretary General of the Sri Lanka Red Cross Society and the Health Subcommittee Chairman Dr. Anura Ekanaike, and the other colleagues from the Sri Lanka Red Cross Society and the IFRC, and from the other media representatives. Very warm welcome to all and very good morning to all. So before initiating today, we are officially begin our journey under the SLRCS Simplified Early Action Protocol for Dengue Prevention. So as the initial, I would like to give a brief introduction on the project, what are the objectives and how we are implementing in the ground level of this project. So when it comes to the Simplified Early Action Protocol, it's a proactive approach designed to reduce the impact of serious disease with hazard. So that is developed under the finance mechanism of the IFRC Anticipatory Hub, and that will be enabled to us to conduct the evidence-based intervention to mitigate the dengue prevention. So we all know dengue is a very hazard to the health system, and also we are experiencing two major peaks during the rain situation. So during that period, it is important to engage with the community and strengthening the community intervention to mitigate the dengue situation in the country. So during that project, we are hope to mitigate that event to strengthening the community action through this project. So as SLRCS as an organization, we have the volunteer based around the country, and also we have the active volunteers and experts from the national level to grassroots level. So we have the experience in closely work with the dengue health system in national level and RDHS level, and especially in 2017 and 23, we are engaged in the dengue prevention activities during the outbreak situation. Also, this is a great opportunity to the SLRCS to strengthening our community collaboration and the coordination with national health authorities and also the district level activities. So when it comes to the project activities, our project is aiming to aiming to conduct the strengthening the community action in order to reduce the dengue prevention, and that will be conducted during the 2 years period starting from July 2025 to June 2027. So when considering the targeted districts, here we have considered the 5 districts. We have the considering the historical data. So we selected Jaffna, Kandy, Gampaha, Colombo and Kalatara districts for our intervention. So we are working in the high-risk MOH areas and the high-risk PHI levels, and to collaborate the dengue prevention with the government authorities. So here we are targeting groups. The more high-risk groups are school children and other people who are in the common areas likewise. So in this project, we have implementing the project during the 2 phases. First one is the readiness phase. In that period, we are focusing to preparation of the activities. So basically, we are focusing the strengthening community awareness and the community empowerment and preparedness for the procurement of some items likewise. And when it comes to the particular level, here we have considered the total number of dengue cases reported in weekly, the 1,500 cases. So when that situation is coming, so we are engaging in the community level intervention. So in that period, we are engaging with the community and the community level activities like cleaning campaigns and volunteer deployment for the health staff and distribution of the particular IEC materials and engaging the school level activities as well. So we think this is the opportunity to us to work together to conduct the dengue situation in the country, and we requested kind support from the National Dengue Control Units and the other media support to mitigate that effect. Thank you.